I'm always amazed at how much misinformation and misunderstanding surrounds varicose veins and thread veins. And in this video, I'm going to tell you the 10 little-known things about varicose veins and thread veins that even your GP may not know. The first thing, which often comes as a surprise, is that the appearance of the veins doesn't always correlate with the severity of symptoms or even how bad the underlying problem is. So, for example, people with very bad varicose veins, which you can see very easily, may not have very much in the way of symptoms. Equally, people who have very bad reflux, that is an abnormality of the function of the veins, these people can have very little to see on the surface. So what you see isn't a reliable guide to how bad the veins are, and indeed how bad your veins are may not be a guide to how bad the underlying problem is. The second thing to tell you is that often severe symptoms and underlying problems can precede the appearance of anything wrong on the surface. So, for example, some people with quite a lot of ache, throbbing and swelling at the end of the day may not have very much to see when they look at their leg to suggest that they have a vein problem. But if you're experiencing ache, swelling and throbbing, particularly at the end of the day, then it may well be worth you getting a coloured duplex ultrasound scan to find out more about your vein problem. Now, we don't know the cause of varicose veins, thread veins and superficial vein reflux. We can identify the underlying problem, which is often a failure of the valves, that's the delicate lining of the veins which come together to keep blood flowing in the correct direction. People can have a problem with the valves, but we don't know what causes that. The strongest predictor is family history, and there's obviously a very strong genetic component. But although other things can aggravate the problem, they don't actually cause varicose veins. It appears that there's a genetic predisposition. The next thing to tell you is that although varicose veins tend to run in families, and so there is a genetic component, if you do have a family history, it's not inevitable that you will develop a vein problem. Many people escape despite having many family members who have a vein problem. On the flip side, just because you don't have any family members or a family history of vein problems doesn't mean that you don't have a vein problem yourself. I see many people with quite serious vein problems who give no family history at all. Now, treating varicose veins before pregnancy will minimize deterioration and will help your legs feel better. Now, it used to be said until quite recently that you ought not to have any treatment to your veins until you've had your family, completed your family and had all your children. Well, this is wrong. We now know that the underlying problem is reflux, and the sooner reflux is treated, the better. It prevents deterioration with time or pregnancy, and it reduces the risks of complications. And the only way to determine whether there's a problem and how to treat it is a colour duplex ultrasound scan. Well, I hope you've enjoyed the first part of my series. There's quite a lot there. I'm going to cover the next series of little known facts about varicose veins in my next video, which will be published next week. Do please remember to click the button above. That way you'll subscribe and you'll be sure to see the next video in the series. Thank you for watching my video.